Welcome to What's Up, Doc, a podcast by Miramont Wellness Centers in Fort Collins, Colorado. Hosted by Dr. John L. Bender, MD and CEO of Miramont Wellness Centers. Our mission at Miramont is to empower your community and yourself to achieve healthcare and wellness aspirations anywhere in life.
Hello, I'm Dr. John Bender.
And I'm Shay Copelin.
And we're here for another exciting episode of What's Up, Doc. Today we're going to be discussing minimally invasive mommy makeovers. So after someone has had their babies and is not planning to have more children, or if they've lost some weight due to the miracles of Ozempic and Wegovy and are now suffering with loose skin, we now offer at Miramont minimally invasive radiofrequency assisted lipocoagulation, which is a long-term or it's a kind of liposuction. And so what is this procedure? Well, let's contrast it first with the traditional mommy makeover. So traditional mommy makeover, the plastic surgeon is going to make a large incision across the lower abdomen. They're going to stretch the skin down. They may have to move the navel or belly button back up to its original position. They're going to cut off some of that skin. A person's going to take several weeks to recover. They'll be wearing a pressure garment and they're going to have a longer scar. But it is the gold standard and it does give the best results. However, not everyone may want to spend $20,000 to $30,000 to have such a procedure. And it may be of interest to people that there are procedures that are minimally invasive that give nearly as good of results that can sometimes be as little as $5,000 to $10,000 range. So let's discuss what's involved. So we are using what's called the IgniteRF platform. And these are radiofrequency assisted lipocoagulation, as I mentioned before. Tiny little incisions. The incisions are literally about this big, enough to let our probe through. This tip is going to heat to about 100 degrees Celsius. Surprisingly, it doesn't tend to cause burns or nodules. Basically, we're lifting the skin, tenting it, and we can hear the fat pop as we go through it. We then do some liposuction. And these are oftentimes done just with some nitrous oxide and Toradol. People tolerate the procedures very well. We do use what's called tumescent, which is a IV type fluid that has some numbing medicine in it and some different factors like TXA and others to help with clotting, as well as some buffers like bicarbonate and adrenaline to help with bleeding. And so we make the two little tiny incisions and we do the contraction. So let's take a look at a few cases that we've done here at Miramont. This first case is Shay. Actually, Shay had the traditional BodyTite procedure that was done with an instrument more like this. So we have two transducers. You can see her before and afters, and she had a really good improvement of the skin laxity. Shay, do you want to tell us a little bit about your experience of that procedure?
My procedure went really well. It was easy. I don't remember being uncomfortable or feeling like, any burning or anything like that. I was able to get up and go on my way right after, which was nice, and didn't have to worry about not driving home on medications that aren't safe to drive home on.
Well, and unlike our previous podcast where we talked about FaceTite, where most people probably drive themselves home, with the BodyTite, it's a little longer procedure. These cases can go 3 to 4 hours. We typically would want someone to have a driver. But other than that, downtime is minimal. We've had people do these procedures on Friday, go back to work on Monday. Do have to wear a pressure garment for about a month afterwards. And as we get into the fall and winter, great time to have these procedures because those garments are warm and they can help with the chilly Colorado weather. Let's take a look at another case. This is Jodi. And you can see Jodi had an outstanding result. She has some laxity. Again, she was finished having her babies. You can see on this lateral projection, the before and after. And wow, what a difference. Very impressive. And her scars are almost not observable. I mean, when you take a look at the post-op, they heal really nicely. Here's another case that we did. You can see her before and after, and she had what she called her apron. You can see the apron hanging over the panty line, and in her post, there's still a little bit of a skin crease where the fold had been, but we treat that then with the Morpheus body, which is the 40-pin microneedling, and that helps to soften that as well. As far as risks and benefits, the risks of the procedure really are bleeding and infection. Occasionally we'll see a seroma. I think we've had one seroma in our last 100 cases. Bruising is more common in people on aspirin or blood thinners. We try to have folks stop that before the procedure. And then the risk of infection is also minimal. Typically, it's something at the surface, and usually just really good hygiene after the procedure, taking care of the stitches can help. And the sutures are absorbable, and they usually heal really nicely. As far as what to expect post-procedure. People are a little swollen immediately afterwards. Even though we do remove some fat, it takes a while for the body to absorb all the fluid. We'll have folks undergo some lymphedema massage.
Yep.
Can you tell us a little bit about the gauze stones or some of the things people do for the lymphedema?
Yeah, so we provide every patient with a little stone, guava stone, and some coconut oil, and we teach them how to properly push that lymphatic away from their body and out, and just it helps drain out that, and your body will help clear it out.
Yes, and so the lymphatics do get disrupted during the procedure, but I tell people it's kind of like if someone shaved their head bald, they're not bald permanently, the hair all grows back. As we are doing the liposuction and the heat energy, it does disrupt the lymphatic system, but that all regrows. And usually within about 3 to 6 months, people can absorb their fluid again normally. Typically, the navel or belly button is the very last area to come through. We also treat flanks, and we also treat thighs, and we also treat underarms. So we've had patients who come in wanting to have their under the arm area treated, or their inner thigh is another favorite. And we can easily access these areas with minimally invasive techniques. Again, the probe is long enough to treat under the arm or along the thigh. And again, the incisions are small. We typically fold them into skin creases where they're hidden, and they do well. So we should probably visit a little bit about Morpheus as well. Mm-hmm. So welcome, Jodi. We're hoping that you could tell us a little bit about the Morpheus body.
Yes, the Morpheus body is 40-pin Morpheus radio frequency. It's basically microneedling on steroids. The microneedles go down into the skin. It creates trauma. The trauma says to your body, oh no, I need to make more collagen and elastin. That in turn tightens the skin and creates a wonderful result.
And typically you're going to depths of 7, 5, and 3 millimeters. And I'm going to be honest, this procedure can be painful, but there's many things we do at Miramont to create what we call the comfort Morpheus. Mm-hmm. We may administer a little bit of Toradol. Mm-hmm. Obviously, the body is too messed with that fluid we were speaking about earlier for the liposuction, which leaves everything kind of nummy. We can also do some Miramont, and we give people nitrous oxide. And the procedure is reasonably well tolerated and gives fabulous results.
Indeed, yes.
Now, how often would someone need to repeat the Morpheus?
We encourage 3 to 4 at least with the face or the BodyTite. And we encourage to do at least at minimum 2 to 3. That will create the best result.
So with the skin tightening, again, this is one and done. Typically, we don't have to repeat this procedure maybe for another decade, unless someone regained 30 pounds or aged 15 years. But with the Morpheus, that procedure, they're going to have their best results with a couple repeated. And these are usually done how far apart?
Typically 4 to 6 weeks.
4 to 6 weeks.
Mm-hmm.
So that would be done 4 to 6 weeks after their initial procedure, and then again after that.
Correct.
Outstanding. Well, Jodi, thanks for joining us. We enjoyed hearing
pleasure.
about the Morpheus.
Yes.
Well, that's all we have time for today. We'll see you next time. I'm Dr. John Bender.
I'm Shay Copelin.
I'm Jodi Watson.
And farewell from Miramont Wellness Centers.